We talked about pain in the low back. Let's move up into the thoracic spine. Quite often you get this chronic pain in the thoracic spine. There's entheses there, ligaments join, especially the costovertebral joint. The rib comes around between two vertebrae, two joints on the rib comes around and joins the vertebra above the disc and the vertebra below it. And plus there's ligaments in the rib where there's ligaments in the transverse process of the vertebra. So any one of those ligaments enthesis there, there might be a problem. We can load those. Or we can stretch them on the opposite side. And as I mentioned before about morphology is very important as well. So we're going to kind of kill two birds with one stone here. Let's suppose this person has a scoliosis as well. Suppose they have a thoracic spine scoliosis. Now, I'm not saying all scoliosis are problems. A lot of them aren't. Just because a person has a scoliosis, that doesn't mean it has to be cared for, or that doesn't necessarily mean that's what the pain's from. But if you want to test for it, we can always test the scoliosis. Let's suppose she has a scoliosis with an apex. Let's suppose she has the convex side is on her right side, and let's suppose it's about T5. The apex is about T5. Okay, so I'm going to see if we can change the morphology on that. This belt locks her down, and it's a fulcrum against that part of the spine. So she's curved this way, and I want to straighten out the C. You ready? You okay with that?
Yeah.
Can I go more?
Yeah.
You see what I'm doing? I'm putting pressure on those vertebrae in the opposite direction that they're bent. Because I can't see her, because she's face down, it's really important she gives me a verbal response loud enough that I can hear it. That's very important. Can I do that again?
Yeah.
Okay, so I just start very gently at first and I increase the pressure. As I'm doing this, I can do the long axis traction as well. Okay. You'll notice this also works on the kyphosis in the area. Similarly, quite often patients get like a chronic pain. Do you want to roll over now? Just roll over onto your. You get a chronic pain in their upper thoracic spine, maybe to the right or to the left. You just can't get to it. Okay, with this here, put your arms above now. Okay. Now, if I'm going too tight, you got to tell me. Okay. Can I go a little more? Now this way, the last one was an extension. This way we're going to do the similar procedure but in flexion. Arms above. Just lift up now. And this is a fulcrum. Is your front okay?
Mm-hmm.
And I give it some traction, and that's putting I want the area right into the area of the complaint. Now, if she says, yeah, I feel it there, then I know I'm targeting the area that I want. Can I do that again?
Yep.
Okay. Flexion to the side, and as long, oh yeah, I feel it there, I feel it there. Sometimes I have somebody helping me. They can pull here to help me with the traction. This is very effective for chronic conditions in the upper thoracic. You can't respond. And with some scoliosis, it straightens out pretty good and it's such a tremendous relief. As I mentioned before, though, just because a person has a curve in their spine, that doesn't necessarily mean that's a problem for them. Okay, good.